Hello and welcome, it's Chris from Christopher Holt Training and welcome to this week's tutorial. We are continuing the conversation on how to overcome low back pain, the importance of exercise. Now, there is a myth, as I mentioned in part 1, that bed rest or rest is good, and it is, but only to a point. What we have to understand is not to be afraid of loading the injured area, so whether it may be a twisted ankle, a bad back, a bad shoulder, whatever it might be, we can't be afraid of loading the joint. So in part 1, I started talking about optimal loading and how it can strengthen the biological scaffolding and making your body more resilient to everyday life. Now in part 2, we're going to continue that conversation on optimal loading, but this time how it can help heal injured tissues. Now obviously we're talking about the lower back, so I'm going to be describing a scenario in the lower back, but it could be at any different area of the body. But before we get into that, I just quickly want to mention my social media, as I do, Twitter, Facebook, Instagram and YouTube. So please do like, follow, subscribe. Please do comment on this video wherever you're watching it, what you've learnt, what you found interesting, or if you do have any questions, just pop it in the comments box down below. Now alternatively, you can follow this link here and it will take you through to the Fundamentals of Spine Health webinar. So you can, in a sense, start your journey by learning all about my formula of how I help people overcome their lower back pain on a day-to-day basis in the gym. So that it's what I use essentially, is I've put it down in this webinar. I talk you through the whole thing. The webinar is completely free. As I mentioned, I share my entire formula for overcoming lower back pain. And if you want to, you don't have to, but if you want to, you can put this into practice by becoming an online client, which I'll share how to do that at the end of the webinar. But if you just want to come and learn how to overcome lower back pain and learn about the formula that I use, then please do reserve your spot. The link is in the description, or you can just take that link and tap it into your internet browser and it will take you straight to the page and reserve your spot. So coming back to what we're going to be learning about today, which is the how to overcome lower back pain, the importance of exercise. So as I've mentioned, exercise is an important part of overcoming any injury, but in particular lower back pain, because it allows optimal loading, and optimal loading promotes collagen fiber reorganization and tissue healing. So as the quote says here, early mobilization and tissue loading, which is a fancy way of saying exercise, but it has to be the right exercise at the right time and in the right dosage, of course, but essentially that's what that means. It has shown to have a positive effect to promote collagen reorganization and tissue healing. Now, collagen is basically the collagen fibers that are the structural scaffolding of your tissue. So I mentioned that in part 1. So it is wise to initiate a loading program as soon as pain permits. So once the pain is reduced, as you're starting to sort of get your movement back, so you're starting to move around a little bit more, it's then wise to start some sort of loading program, which is an exercise program essentially. So what we can see here, now this is the example that I'm using with regards to lower back pain. There are more examples, I'll explain that in a second. But what we've got here is we've got these little trigger points. You can see them on here, so these dark sort of red areas. Now they are tight tissues, so they are small knots in the muscles. Now these small knots that in the hip are located here, here and here. Now if this trigger point is causing you problems, you get pain at the base of your spine. If this trigger point is causing you problems, you get it down the side of the buttock and the side of the thigh. And if this trigger point is giving you problems, you get it across the lower back and then down and around into the buttock. And obviously the same would be for the other side, depending on which trigger point is giving you the issues. Now, if you exercise correctly, you can reduce your small knots and therefore reduce the incidence of pain. So what we have to understand is that exercise can play a role in reducing how these knots create tension and create pain in your body. So if we can get our exercise right, they will reduce. So what we have to understand is, in a sense, the cause of back pain. So I understand that trigger points aren't the only cause. Now, but optimally loading with the correct exercise can help overcome lower back pain if you do it right and you're patient. So first of all, we have to understand that. Now, what happens during lower back pain is muscles and other tissues, so tendons, ligaments, so on and so forth, they will tend to tighten or they'll go into spasm. And that's what these little trigger points are doing in your hip. They're becoming tight, or they're going into spasm. Now that's there to protect the area. Now the technical term for that is muscle guarding. Now what happens after lower back pain? So we know that things are starting to tighten during, so what happens after? So after the pain is gone, muscles and tissues hold on to this tightness and or spasm as a means of protecting the area, or keeping a degree of protection to the area. Now, whether you have trigger points, back spasms, disc bulges, disc herniations, whatever it might be, exercise and optimal loading can reduce this muscle guarding and return your body to a healthier state. So it's making sure that when we've reduced the pain, or when the pain has started to reduce, we can start bringing in movements and bringing in exercises to remove the residual tightness and or spasm that is left behind after injury. So it's very important that we make that clear, because so many people are afraid to use that joint, to exercise that joint, to load that joint with weight, and it's not wise to do it at an extreme level, but it is wise to start doing it. So massaging and foam rolling, stretching and exercise is that loading program that will allow your tissues to promote sort of collagen reorganization and tissue healing. So to summarize, exercise allows optimal loading. Optimal loading reorganizes collagen and starts healing your tissues. So muscles and tissues become tight during and after injury, and to rehabilitate these tissues, exercise or optimal loading, I should say, is essential. So what we have to be able to understand is that don't be afraid of moving and loading the joint. As long as you do it correctly, that's how we overcome lower back pain. We don't overcome it by just resting and leaving it and then the pain going, because the injury hasn't gone. So you haven't, in a sense, overcome the low back pain. Exercise plays a pivotal role in overcoming lower back pain. We just have to get it right. So many thanks for watching. My name is Chris. I hope this has been helpful, and I will speak to you in part 3 of how to overcome low back pain, the importance of exercise.